Hello, I'm Heather Knox, Chief Executive here in NHS Lanarkshire. I'm going to talk to you about three things today. First of all, I'm going to talk about the numbers and our response to COVID during this second wave. Secondly, I'm going to talk a bit about the vaccine news that we've had this week. And thirdly, I'm just going to say a bit more about the measures we can take to protect each other. So if I start with the numbers, we've seen the numbers of new cases gradually decreasing in Lanarkshire, which has to be good news for all of us, and we're still in that level 3, which again is good news. Going forward, that will be reviewed on a weekly basis, but we've got another week at the moment at level 3, and we'll see where that takes us in the run-up to Christmas. Our numbers are still high though in our acute services, and in particular ITU services across the last maybe 10-12 days have been very, very busy. And here Mars in particular has had a high number of ITU patients. What I would say is that our community teams across the health and social care partnerships have been fantastic, and they've freed up staff to support the acute side. So about 25 staff, I think, from South Partnership have been moved into acute services, and a similar number from North. So really grateful to partnership colleagues for freeing up staff to support the acute activity during this busy period. As I've said before, it is very difficult at the moment because we haven't really stood down any acute activities. The elective programmes are still running for urgent elective cases. The second thing I wanted to talk about briefly was that there does now seem to be obviously some news around a vaccine, so that has to be positive. There are, however, lots of logistic issues around the delivery of that vaccine that do need to be worked through, and I think the virus will be with us for several months to come. So the important thing in phase 1 of delivery of that vaccine will be to protect the vulnerable people who've been shielding, but also to roll out that vaccine to health and social care staff, particularly in care homes, but also in hospital settings and the community. So our staff should be within the first wave of those people that are vaccinated as we go forward, but it is a whole population vaccination programme. It will be the biggest thing we will ever have done in the history of the NHS in terms of vaccination, and will take us several months. So it's good news, but I think even given the news about the vaccine, the virus is going to be with us for several months to come, probably through to next summer. So we should plan on that basis. The third thing I want to say is we have a fantastic test and protect service, and it's been particularly effective actually in Lanarkshire, and I'm proud of the work the public health team have done, and that's been pretty relentless for them really over the last 12 months, and they've done a great job. However, that's our second line of defence for this virus. The first line is our behaviours and the way we go about our hand washing, our 2-metre distancing, and increasingly now the use of face masks as protection. So I've asked my Gold Command colleagues to review the use of face masks in the office environments. At the moment, I know staff are wearing them in communal areas, but I would recommend that you do wear them if you are in an office with other colleagues, even if you are 2 metres apart. There is now increasing evidence that the virus can be airborne in small areas like offices, so I would recommend be prudent, look after yourselves, and do take that additional precaution, please. I'll end by just saying thank you again to all of you for all your efforts during this difficult time. Thank you.